Greetings. My name is Karen, and I am a recovering medical jargon junkie. Yep, it's true, but I'll get back to that. First, I'm curious. Have you or someone you know ever left a healthcare visit more confused than when you came in? Maybe you didn't understand some of the medical terms, felt rushed, or maybe even a little intimidated to ask questions. Well, if so, you're not alone. Research shows that 9 out of 10 US adults have difficulty understanding and using health information. That same research shows that patients forget up to 80% of the information given before they reach the parking lot. And the real kicker, about half of the information that is recalled is incorrect. Well, I think we can all agree our healthcare system is complex, and patients often feel powerless. At the same time, overworked and burned out health professionals may not realize barriers that they create. Well, I've witnessed this reality throughout my career. With decades of experience as a registered nurse and as an internationally recognized leader in the field of health literacy, I can tell you this: confusion in healthcare is not the exception. It's the norm. And that's why I'm here today, to share how you can help rewrite that narrative. But first, a little background, starting with a quick story about my friend Linda, an extremely outgoing, brilliant chemical engineer who called one day clearly upset after an appointment with her rheumatologist. Now, being a nurse, it's not uncommon for me to get these types of calls, so I said, "Well, Linda, what happened?" "Karen, I didn't understand a word the doctor said." "Linda, did you ask any questions?" Well, no, they seem super busy, so I figured I'd come home, call you, and then Google it." "Linda, that's not how this is supposed to work. In these days, it's not just Google. People are even using artificial intelligence or AI tools like ChatGPT to ask their questions instead of asking their doctors. And that don't ask, just look it up later habit is surprisingly common. A 2023 National Patient Point Survey found that roughly half of Americans are hesitant to ask their doctors questions. And 43% use Google as their primary source for health information. So we have to ask ourselves, why? Well, that white coat, the rushed visits, it's no wonder you might sometimes feel as though you're not supposed to speak up. And there's a real sense of hierarchy in healthcare, and all that medical jargon only makes it worse. Which brings me back to my own story, the medical jargon junkie. Well, I knew I wanted to be a nurse from the time I was about 8 years old. Yes, that's a photo of me caring for my little brother, stethoscope around my neck. So it's always been on my heart to care for people. But when I was a younger nurse many years ago, I thought I was being helpful, throwing around terms like idiopathic, hypertension, myocardial infarction. But I was actually part of the problem. At one point, I worked in an intensive care unit, caring for people after their open heart surgery, and I loved educating my patients. I gave full-on mini med school lessons on atriums, ventricles, coronary arteries. I used diagrams, hand gestures, the whole 9 yards. I was like Bill Nye the Science Guy of the heart. But the truth, and what I didn't see, was that my patients were nodding as if they understood, while at the same time, their eyes were glazing over. I thought I was empowering them, but the truth, I was completely overwhelming them. And here's the thing, confusion should not be the price of admission to every healthcare encounter. But I didn't see it back then, and that blind spot followed me for a really long time. I did not truly understand the depth and breadth of poor communication in healthcare until I lived it on the other side of the stethoscope. For over 2 decades, I navigated the healthcare maze alongside 3 of my siblings, Kevin, Lynn, and Bernie, shown seated in this photo, all diagnosed with the same rare, debilitating disease when they reached their 30s. And along with my one healthy sister, Mary Kay, we all struggled through numerous specialty office visits, hospitalizations, and way too many surgeries to count. And as the disease progressed, the toll grew heavier, from contractures that twisted their hands, to, in my sister's case, the devastating loss of both of her legs. And despite being a nurse and an educator, I found myself overwhelmed and frustrated with all the confusing instructions and miscommunication. There were moments of anxiety so heavy it felt hard to breathe, and moments of fear so sharp it cut right through me. But the hardest was the anger. The anger at the times where we felt dismissed, and the anger at myself for not speaking up more than I did. Our family motto became, "We do hard." Let me take you back to a moment that still stays with me. It was October 2015. I was in the emergency room with my brother 1 week before he passed away. He was in a lot of pain and simply exhausted. Well, a doctor walked in, looking down at his clipboard, glasses perched on the end of his nose, never looking up at us, and said, "Mr. D, you have a new arrhythmia. I'm ordering you disopyramide BID." He then handed me a stack of papers and said, "When you're signing these, you're free to go." He then walked out of the room. Well, I looked over at my brother's face, and his jaw was literally hanging open. He had no idea about what had just happened, and that moment broke my heart. But that moment also lit a fire in me, and that personal fire became a professional mission and lit the path to my life's work in the field of health literacy. Now, I understand health literacy is a term not people hear every day, and it's often misunderstood. So to put simply, health literacy has 2 sides. First, it's personal, which is about how well you are able to access or find, understand, and use health information. Then there's organizational health literacy, which is about how well health professionals and organizations support you in doing that. Over the last decade, I've dedicated my work to improving organizational health literacy. I've trained thousands of health professionals in numerous organizations on how to make it easier for patients by applying evidence-based health literacy strategies like plain language communication and teach back, which is an approach involving asking patients to explain back in their own words what they've understood to confirm understanding. I also began working on the whole system side, helping to push for policy change by building state and national health literacy organizations. But I have to tell you, some days it's felt like trying to carve a river one spoonful at a time. So today I'm switching gears. Today I'm here for you to share how you can be the change in your next healthcare visit. Because the issue is more important now than ever. Because right now, AI is becoming more and more visible in the healthcare space. And if you're going to trust it, you're going to need to be able to ask if, when, where, and how it may be used in your care. AI at its core refers to computer systems designed to perform tasks normally requiring human intelligence. But it's not some far-off concept. We all use it every day. When Netflix recommends your next show, when your GPS reroutes you around traffic, or your phone auto-completes a text, that's AI at work. And if designed well, AI has the potential to improve healthcare communication. A tool called Ambient Listening AI can record your visit, take notes, and free your doctor to look you in the eye instead of down at a computer screen. It can also translate complex medical language into plain terms so you don't leave wondering what disopyramide BID even means. It can also answer your basic questions through chatbots, which can be especially helpful if you live in an area with limited resources or access to care. Now at this point, some of you may be wondering, does this mean my doctor is being replaced by a robot? And the answer is no. AI is not replacing your doctor. Your doctor is still responsible for reviewing any transcribed notes and for making all final decisions. AI is an assistant, not a decision maker. But here's the catch. Like any other tool, AI is only as good as its human design and the human conversation around it. It can support your care, it can assist in your visit, but obviously it cannot speak on your behalf. That voice still needs to come from you. Now I understand and I get it, in a rushed appointment this may feel daunting. But if you've ever felt cut off during a visit, you're not imagining it. In 2018, Dr. Singh, Ospina, and colleagues found that doctors typically interrupted their patients after just 11 seconds. Now, obviously, that's not enough time to feel heard or understood. And that happens, and you hold the power. But I do want to be clear, most doctors and other health professionals truly do care about their patients and wish they had more time to listen and to explain. But the system just doesn't always make that easy. So we need to come in with the mindset that we are partners in our care. So the heart of my idea is this. The best way that you can help rewrite the narrative of confusion in healthcare is to find and use your voice. That's why I created a simple framework to help you show up, speak up, and stay in the driver's seat, even in the age of AI. It's called 5 Steps to Better Health Literacy. First is speak up. Let's not be like Linda. If you don't understand a concept, an instruction, or a medical term, say so. And if you feel hesitant, here's something to hold on to. Your doctor's job is to take care of you, and you have the right to understand what's going on with your health. Next is to take notes and bring someone with you, because remember, many of us forget up to 80% of the information that we're given. So then it's important to explain what you heard. This means using a technique I call check back, to make sure that you've understood. You might want to say something like, just to make sure I'm clear, you told me I'm supposed to start taking this medicine on Wednesday? Right. Then P is prepare questions. Write them down ahead of time, as well as any concerns you might have. We've all left an appointment thinking, oh, I forgot to ask. Then finally, seek clarification. Be sure to ask about your next steps, including any follow-up visits, lab tests, and also how to reach your doctor in case you have any further questions. When you do these things, you are stepping into your power and making sure that your voice is being heard in every exam room every time. Yes, the healthcare system is complex, and yes, AI adds another layer to that. But you, the patient, the caregiver, the loved one, you have more power than you think. You are the expert in your own life, and your voice, it just might be the most powerful tool in the room. So let's stop treating confusion as just part of the healthcare experience. Let's start being the change by speaking up and taking control of our care. Now, my hope today isn't just that you've learned something or you might feel a little inspired. It's that you act, that you walk into your next appointment as a partner in your care. Because when you change the conversation, you don't just change your own experience, you change healthcare, one voice at a time. Well, all 3 of my siblings are gone now, but the fire they lit in me, it still burns. And I hope, just maybe, I've lit a little fire in you too. I'm Karen, no longer a jargon junkie, and I thank you. Thank you.